Hello everyone. I wanted to add this video about the MMPI and projective personality test. The book covered it a little bit briefly, but I think they're both really exciting and interesting. And so I wanted to tell you a little bit about them and why we actually use them. Because how do we get information from people who aren't cooperative or who don't want to give us information? If you think about it, psychologists are tasked with evaluating people charged with different crimes. A lot of times in court situations and custody situations, psychologists will do psychological evaluations of parents and try to determine who's the most capable parent. So a lot of times we have people that we want to try to psychologically evaluate that may not be cooperative and may also not want to be truthful with us. If you think about it, there have been a lot of criminals in the past that have tried to fake mental illness in order to try to get out of their crimes, although you don't get out of your crimes just because you have a mental illness. But anyway, the MMPI is a really sophisticated test that actually can determine if somebody's trying to fake mental illness or they're trying to fake good, or it can actually determine if a person suffers from a particular psychiatric disorder. So we'll talk about that, or psychological disorder, I guess. We don't have to say psychiatric. So an MMPI is the long title is the Minnesota Multiphasic Personality Inventory. And we're in our second, actually third version now, and it's what we call an objective personality test. So the personality test that you took for the assignment are really more subjective personality tests. The Big Five personality tests, you're rating yourself on those particular tests, and you could actually try to fake good or fake bad, and you can tell what question, how to answer that particular question if you wanted to appear a certain way. So they're actually something that you could manipulate yourself if you really put your mind to it. Whereas the MMPI is not something that you can do that. You could try to do it, but it will actually determine that you're being deceptive. So the MMPI is a paper and pencil test, and it has 567 true-false questions that have 10 different aspects of personality that they rate you on. And think about how many questions that is, 567 questions. And the reason it's so many questions is they ask the same question multiple times in different ways, and that's part of the way that they determine whether or not somebody's trying to be deceptive. If you answer the same question so many different ways, or consistently different ways too many times, then they start to get concerned that you're being deceptive. So there is a new version of the MMPI that's a little bit shorter, but it's still pretty long, 338 true-false questions. But this one is probably something that is more widely used now because it is shorter and probably quicker to take. But the MMPI can reliably detect different psychological disorders like schizophrenia, depression, bipolar, anxiety, and antisocial personality disorder. And it's really interesting how they actually developed this test. What they did was they took large groups of people that were diagnosed with schizophrenia or bipolar, and they developed questions that they thought these people would mark as true or false. And then they picked those questions out that the majority of them marked as true. And then they gave new groups of people with that diagnosis those tests, those questions, and threw out any ones that were not consistently marked true. And so it's really interesting how they developed this test. And it's actually a very valid test. If somebody comes up with a score on the MMPI that shows they're depressed, very likely that they're depressed. If it shows they're schizophrenic, I don't know what the statistics are, but it's pretty high that they actually are schizophrenic. But one of the main things when we're doing a psychological evaluation that we might want to look at is the psychopathic deviant, which is what we really call antisocial personality in psychology. But you have heard the term sociopath and psychopath, and antisocial personality disorder you might not have heard, but all three of those are basically the same thing. They're just a person that has very little emotion, very little empathy for other people, and very little concern about other people. So that's an important scale that we look at. Paranoia, When we look at schizophrenia, we might also see somebody that's rates high in paranoia as well. Psychasthenia is obsessive compulsive disorder, which is an anxiety disorder. Hysteria is also anxiety disorders. It's a Freudian, an old term for anxiety. And then mania. So we're looking at manic depression or bipolar disorder here. So if a person scores high in these areas, they will come up as being uh, having that particular disorder. So it's really helpful in just really sorting out the symptoms a person might have. Um, so it's the most widely used objective personality test. It's often used to make decisions about custody in criminal cases, and it's a very sophisticated test. It's also very expensive. So if you went and saw a psychologist for counseling or a counselor, you're not going to get an MMPI. It's really used mostly in the justice system, but it is certainly used in different research settings and in other settings. But it's a critical part of a psychological evaluation, along with an IQ and other tests that we give to really try to get a clear picture of a person, and especially of a person that may not be honest with us or may not want to give us information. The MMPI is also used to hire police officers as well. So when you're looking, and some of you may be working at becoming a police officer, we want somebody that's mentally healthy, mentally stable as a police officer, and they are highly screened for that information because they do have such a difficult role in dealing with people and dealing with really difficult situations. So we definitely want to make sure that the police officers that we hire are psychologically sound. So the MMPI does contain validity scores to determine if somebody's trying to fake good or fake bad. And I think I mentioned that before. It's called the deception scale. So there's a whole separate scale besides schizophrenia and all those other ones that says whether or not the person's trying to be deceptive. And the way they determine that is by asking the same question many times over, a little bit differently, but it can detect whether or not you're answering those questions too many contradictory to each other. So if you have to take this test to become a police officer, I don't know of any other fields that they actually use this test. Just be as honest as possible and don't try to, answer the way you think they would want you to answer, because you might come up as deceptive, and that's not what you want, because it probably won't get you the job. So these are some ideas of some examples of the sample questions that might be on the MMPI, and I'll just show you. We'll just focus on these black ones and maybe the blue ones too. But the black ones here, I sometimes tease animals. I don't like everybody I know. This is assessing for antisocial personality disorder. Once in a while, I think about things too bad to talk about. So somebody that has antisocial personality disorder would most likely mark these questions as true unless they're trying to be deceptive, which they could be. The blue ones indicate schizophrenia. My soul sometimes leaves my body. I have strange and peculiar experiences. So, these are questions that are a little bit odd, but they really do get at a person's thought process and a person's mental state. Um, so this is just a repeat about psychological evaluations, but in child custody cases, divorce cases, and anytime somebody's charged with a serious crime. So we're going to give them an IQ test, we're going to give them an MMPI test, and then we're also going to give them a projective test, which we're going to talk about in the next slide here. And then there are also some other scales that we can use to really try to standardize our evaluation of people, especially criminals. There's something called the Hare psychopathology checklist that was developed by Robert Hare in 2003. And he came up with two different factors. I think this is interpersonal and I could be wrong. But these are all different traits that a person with psychopathology or with antisocial personality may have. And if they have enough of these symptoms, I think looks like there's 20, I thought there was 24, might be blocking some of the other ones. And if you have more than 12 of these symptoms, then you would be considered antisocial personality disorder. And some of these are like historical things, juvenile delinquency, information you can get from records, not necessarily directly from the person that you're evaluating. So projective personality tests often are made fun of. Most of you have probably heard of the Rorschach inkblot test. But the whole purpose of a projective personality test is to present the person with something ambiguous, something that doesn't really mean anything. So an inkblot doesn't really mean anything. And what we are hoping is that that person's going to project some personality traits onto that image and give us information about their personality. Now, projective personality tests are not necessarily scientific. They're not necessarily, we're not looking for a specific answer on these tests. It's just another way to get information about people, maybe when they don't want to volunteer it, or just maybe a different way to get information, an interesting way to get information. So Herman Rorschach here, developed the Rorschach inkblot test in 1921, which is really interesting. And then the person's asked to describe what they see in that picture. With the thematic apperception test, it was developed in the 50s, and it was they were asked to tell a story about pictures that they see. So it gives us a lot of information that a person might not normally volunteer in an interview, and it gives us interesting information. So it has 10, so the Rorschach inkblot test, this is an actual card from the Rorschach inkblot test, and there's 10 different cards in there. And we would present this card to somebody, and somebody who maybe suffers from schizophrenia might say they see the devil in this. They might say some pretty odd things that they see in this. Whereas many of us might see a mask, we might see the devil. Some students have said they see elephants over here. I can sort of see that, or even chihuahuas. You could see chihuahuas there. You know, there's a lot of different things somebody could see, and maybe an insect in here. And it's really not what the specific thing that the person sees in there is not what's important. But if you show a person 10 different pictures like this, and a lot of times there can be a theme with those pictures. Sometimes people will see blood in this one. Sometimes people will see people fighting. Sometimes people will see like a spaceship here, like Star Wars or something in the middle here. But it really tells you what's important to that person, what's interesting to that person, and what they're seeing. And of course, you get people that maybe don't volunteer information. But apparently, a moth or a butterfly. I don't know if I see the butterfly. Is a really normal, average kind of response. But there's lots of different responses that people can give that give you interesting information. The TIT is the thematic apperception test, and it was developed in 1920. Oh, I said 50, but it's 20. Some of these pictures look kind of 1950s to me. But it has 20 different black and white drawings of different situations, and it asks the person to tell a story. What do you think is going on in this particular picture? And I would always show this in my class, and we get all sorts of different stories. It's an old lady jealous of her youth. It's it's the evil witch from Snow White getting ready to give her an apple. Who knows? In this one here, my student said, he's drunk. She killed him. It could be any variety of stories, but it tells you a lot about the person's parental relationship. They may see themselves in this picture, so you get a lot of interesting information that you just wouldn't get otherwise. This picture here is a little bit weird. Is it an exorcism? Is the kid getting abused? I don't know. And I don't know if you guys noticed anything about these pictures, if you noticed any particular cultural issues with these pictures. I'll go back and show you the other ones. It's hard. That one's a little harder to tell, a little more ambiguous. But the characters in here are white, pretty much. In the situations, these are very old-fashioned kind of pictures here. These are probably from the original TAT. You can't get the actual pictures of the TAT on the internet because they don't want to publish that out to the general public. So these are just pictures that I found that were from the original TAT. But there's some definite cultural concerns about these pictures, and also just dated concerns. Some of these situations, many of us might not even have experienced. So the TAT has been updated and translated into different cultures, and different ethnic groups here in America as well, and different age groups as well. So there's an adolescent one, there's one for children, because if a child is looking at two pictures of an adult, they're going to tell you a whole lot of different stories than if you show them a picture of a kid. And the same thing if you're from a different ethnic background. If you're looking at pictures of white people, you're going to tell stories that you might think about white people, but it might not really relate to who you are. And so what we really want is for people to connect with these pictures and come up with stories that really tell us about them. The book mentions one about African Americans, that there's a specific TAT for African Americans as well, with situations that maybe African Americans have experienced before and can relate to, and will give us information. So these projective tests are really just wanting to people to project their personality onto the pictures or the ink blots, and it's really just another way for us to get information about people in a different way. So that is it.